Patients who are experiencing a critical illness or injury are facing a long hospital stay, and the road to recovery is strenuous. Muscle strength decreases at a rate of 3 to 11% every day someone is on bed rest. This decrease in muscle strength leaves a patient unable to care for themselves as they recover. In the ICU where I work, they have implemented the ABCDEF bundle, which is a toolkit guiding the management of patients requiring mechanical ventilation. In this toolkit, the E stands for early mobility. Beyond that, there is very little direction. And without direction, the ICU nurses are left not really knowing how to proceed. My evidence-based proposal, I will implement an early mobility protocol to give the nurses the knowledge and the guidance that they need to mobilize patients and maintain muscle strength. As you can see from the graphic on this slide, critical movement is a multidisciplinary team program for progressive mobility in the ICU. The multidisciplinary team includes doctors, nurses, physical and occupational therapy, techs, respiratory therapy, and family members. In the picture on the slide, you can see it takes a lot of different people from a lot of different disciplines to mobilize patients who are on a ventilator. The old adage, it takes a village, definitely applies here. Screening for safety is a screening done on admission that assesses the patient's mobility prior to admission. Understanding the baseline mobility of the patients helps the team adjust the mobility level for each individual patient. An ongoing mobility assessment is done twice a day prior to mobilization. This assessment is done by the nurse. It is designed to assess the patient's medical stability in order to understand where the mobility protocol will begin. Remember, just because the patient is unstable does not mean that they're not going to be mobile. Those patients who are unstable begin at level 1. With the information gleaned from the mobility assessment, the mobility team can then mobilize the patient. Mobility is done intentionally and with purposeful movement. This includes movements that are meant to engage the muscles because the goal here is to retain muscle strength. Mobility progresses according to the 4 levels on the bottom right of this graphic. When the activities in one level are met, then the patient progresses to the next level. An example of this is the patient is able to move their legs against gravity and sit upright. That's level 2. Then, if they can do those things, they progress on to level 3, which is moving into standing with assistance. Mobility and ongoing evaluation continue throughout the patient's stay in the ICU using the level 1 through 4 guidelines. Mobility levels are documented in the EHR and on the whiteboards. When the patient reaches a point that they no longer need ICU care and they are being transferred to a lower level of care, the nurse will document the mobility level in the EHR. The nurse will also do another safety screening to assess the level of mobility at the time of transfer. This will help determine if the mobility protocol allowed the patient to retain their muscle strength. The nurse will pass the patient mobility level on to the receiving nurse when bedside report is given. At the time of transfer, the doctor can then write orders for physical therapy or occupational therapy consults. As you can see, the critical movement mobility protocol was designed to give guidance and direction to the mobility team so they can properly mobilize patients.